deal about the arterial supply of the different surface of the cerebral hemisphere. First thing that we'll be dealing is the superolateral surface. So in this way we have to remember that the superolateral, medial and inferior. This is a way how we learn the functional areas and the sulci area also. So in this way we have to remember, and first thing it will be MAP, then the map, then the second thing is keep the P the constant and reverse the first row, so you'll be getting AMP. Third one will be reverse the whole of the second code, we'll get PMA. This is the only thing that we have to keep in mind, and we can do we can draw the figure, and also the theory also we can take up from this code. So first thing will be superolateral surface. In that case we know that the major thing will be supplied by M, a middle cerebral artery, and there what all we can see the frontal eye field, the motor areas, then the Wernicke's, Broca's, all those areas we can find here. Then next thing will be A. In case of A, the anterior cerebral will be supplying a narrow width of about 2.5 cm along the parieto-occipital, because here it will be parieto, here it will be occipital. Along the parieto-occipital sulcus, anterior cerebral will be supplying. Then the third one will be P. In case of posterior cerebral artery, we know a lobe will be having a pole, because if we are taking this as the temporal lobe, then it will be having a pole. So the posterior cerebral will supply the temporal lobe except the temporal pole. So temporal lobe plus the occipital lobe will be supplied by the posterior cerebral artery. In that way we have finished the superolateral. In the similar way we deal with the the medial surface. So in case of medial surface it will be A. That is, A means anterior cerebral will be the will be the main artery that is supplying the medial surface. Mainly the thing that is having the here we will be having the paracentral lobule and all, that will be supplied by middle anterior cerebral only. Then the next thing will be the middle cerebral. Middle cerebral means it will be supplying the temporal pole. Here the temporal pole was excluded. Here the temporal pole will be included, and it will be supplied by the middle cerebral artery in the medial surface. Next thing will be the posterior cerebral artery, that will be supplying the occipital lobe of the cerebrum. That is the thing. So in that way also the medial surface we have finished. Then the third thing is about the inferior surface. In case of the inferior surface, the whole of the inferior surface except the temporal pole, because temporal pole we have already learned it is supplied by the middle cerebral in case of the medial surface. So here except the temporal pole, most will be supplied by P, as the code says PMA. So posterior will be giving. Then the next thing is this PM for middle. Then the lateral part of the orbital surface of the frontal pole. This is the frontal pole, and the lateral part of the orbital surface of the frontal pole will be supplied by middle, and the medial part by the anterior. This is a way to remember the arterial supply.